This just came out last week, just last week. This is from Justin Hunt, who worked with me on the American Psychiatric Association committee. He was a graduate student. He's a psychiatrist with Dan Eisenberg's group, and this is the first one, and I'll tell you why this is important. He looked at nearly 16,000 adults, 22 years or older, who had entered college. He used that same database that I referred to in the Blanco study, the NESARC, the National Epidemiological Survey for Alcohol and Related Conditions. And he came up with the notion that there were 5 diagnoses that were significantly related to failure to graduate from college or university. They were bipolar type 1, the one you would characteristically recognize with both manic episodes as well as depressive, marijuana use, amphetamine use, cocaine abuse, and then lastly, antisocial personality disorders. For those of you who don't know what an antisocial personality disorder is, it is what we call a cluster B personality disorder in the diagnostic categorization that we use in the American Psychiatric Association, but it is characterized by people who do not nice things to other people and frequently do not show remorse or guilt. They use people for their own needs. They can be very, very engaging socially, but ultimately they go on to do acts that are either illegal, very destructive, and very difficult to treat because they have often no sense of anxiety or depression because it's really not a conflict for them. What turned about surprisingly that was non-significant was alcohol use disorder, major depression, anxiety, that was panic disorder with agoraphobia, people who, for example, have difficulty leaving their home or their college room, social anxiety disorder, and generalized anxiety disorder. I think that that study is off the mark when it comes to alcohol use disorder. And Breslau's study 2 years ago did not support that. Failure to graduate does have something to do with extensive alcohol use. There were limitations in the study, that is to say it wasn't able to pick up when you had more than one kind of problem. You didn't take a look at the dropouts who later could graduate. And as I mentioned before, the trouble with that NESARC study is it didn't have a lot of important kinds of disorders included. When it comes to college, attention deficit disorder is a biggie. Borderline personality disorder is a biggie. And of course, schizophrenia and OCD are not included in that NESARC database. Nor were general medical or substance abuse-induced disorders, namely what happens when you drink too much, take too many medications, and you get depressed from that.